Good afternoon, friends. I am Dr. Pankaj Maheshwari. I am Senior Consultant and Chief of Urology at Fortis Hospital, Mulund. In the last video, we have discussed about how stones form and how stones present. Now we will talk about how to treat once you have a stone. As I have told you, small stones do not need any treatment and they tend to come out on their own. So if you have a stone which is smaller than 6 to 7 millimeters, the treatment will be just watchful observation of the stone. By this we mean that you will need to take the lifestyle precautions like drinking a lot of water, exercise, diet care, which has already been explained. There will be some medicines given to you which will help you reduce your pain. There will be one tablet which will be given which will help the expulsion of the stone. And every week we will be doing some radiological investigation to document movement of the stone. If the stone keeps on moving downwards, then we can wait to a period of 1 month for the stone to come out. If the stone refuses to move or stone grows or patient has significant symptoms, that is the time we will need to intervene for this small stone. But most small stones lesser than 6 millimeter would come out with medicines. The chance of stone coming out will be higher in women as compared to men. It will be higher at younger age as compared to elderly age group. It will again be higher in non-diabetic, physically active men as compared to diabetic patients who are not physically active. So remain physically active, control your sugar well, take all the dietary precautions, take the lifestyle changes, and let's hope the stone comes out on its own. If the stone is large or if it doesn't come out on its own, then we have few treatment options. The first and foremost option is called as ESWL or Extracorporeal Shockwave lithotripsy. A lot of people call this as laser, but this is not laser. These are basically water pressure waves which are focused on the stone. With these water pressure waves, we expect the stone to powder and we then expect the powder to clear on its own through the urinary passage. So any stone which is smaller than 2 centimeter in a patient who has a good functioning kidney, no infection and no obstruction to kidney should be treated by ESWL. ESWL is a OPD treatment. There is no anesthesia needed. You have to lie down on a table. One water bag will touch your back and the waves they hit you like this. Around 2500 to 3000 shock waves will be given. This treatment is nearly pain-free. No anesthesia is needed. You will walk in on the table, walk out from the table. You can straight go to your office and your routine work after this treatment. Maximum 3 sessions of lithotripsy will be given. If the stone doesn't clear in 3 sessions or doesn't break in 3 sessions, lithotripsy will be considered as a failure. So as a doctor, my role will be to choose patients who can be completely cleared by 3 sessions of ESWL. Despite the best care, the success of ESWL will be to the tune of 80 to 85%. So despite best care, there will be 15 to 20% patients where the stone either doesn't fragment or doesn't clear post ESWL. Still, because ESWL is the least invasive treatment, wherever possible, this should be the first line of treatment. In patients who have larger stones or if ESWL fails, then the next treatment is called as flexible uretroscopy. It is also called as RIRS, means retrograde intrarenal surgery. In this, a flexible, very small telescope, around 2 to 3 millimeter telescope, goes through the urinary passage till inside the kidney. Under vision, the stone is powdered by a technology called as whole beam laser and the powder is removed at the same time. The advantage of flexible uretroscopy is that the success rate will be much higher than ESWL because I am doing it under vision. I am clearing the fragments. I don't wait for the stone fragments to clear on their own. Even hard stone which may be difficult to break by ESWL can be broken by whole beam laser and with flexible uretroscopy. The disadvantage of flexible uretroscopy obviously will be the cost is higher and you will need at least 1 session of anesthesia to clear your stone. The final treatment option is called as PCNL or percutaneous nephrolithotomy. Patients who have very large stones in the kidney or where the kidney function is reduced, there One or two small punctures are made in the patient's back. A tract is made from the skin to the stone. Through this tract, a scope is inserted. Under vision, stone is fragmented and removed. PCNL is extremely successful treatment for large stones. So if you have a stone more than 2.5 centimeter, or a very hard stone, or usually large stones called as staghorn stones, then through PCNL it is possible to clear the stones. Bottom line, friends, will be irrespective of if you have all these modalities of treatment available in today's time, open surgery is not needed for stone treatment. So no open surgery for stones. With a combination of ESWL, flexible ureteroscopy and PCNL, all stones, irrespective of their size, hardness, renal function, can be removed without resorting to open surgery. Finally, once the stone is cleared, we remember that stone is a recurrent problem. So it will be important to take precautions so that we help prevent stone recurrence. 3 precautions we have already discussed: drinking a lot of water, enough to produce 2.5 liters of urine, adequate exercise, and restricting salt. Specific precautions will be based on the analysis of stone that is removed. So all stones that are removed should be sent for chemical analysis. We should know what these stones are made of. So based on what we find as a chemical composition of stone, specific lifestyle care can be taken to prevent stone recurrences. Before I conclude, I would want to say, friends, do not undergo open surgery for stones. Do not undergo invasive treatments for small stones which are likely to come out on their own. There is no medicine, mind my word, there is no medicine, whether allopathic, Ayurvedic, homeopathic, which can dissolve stones. Stones cannot be dissolved, stones can only be flushed. So small stones, wait for them to flush out on their own. If the stones are larger, depending on what your doctor advises, choose between ESWL, flexible ureteroscopy, or PCNL. With these treatment options, open surgery is not needed. These treatment options can be repeated if the stone recurs. So have a healthy lifestyle, maintain your kidneys well, and don't worry or panic if you have a large stone. Best wishes and thank you.